Is your dog's vomiting just something simple from eating too much or too quickly, or could it signal something a little bit more serious? Dog vomiting is something that every single dog owner has experienced at some point, and it sometimes can honestly be really tricky trying to distinguish how worried you need to be and how serious it is. If you're new here, hi, my name is Dr. Shallon. I'm a small animal veterinarian, and believe me when I say I've seen just about every dog vomit there is. Today we're going to go through all the common reasons that dogs vomit, when it is okay to monitor them at home, and also what to do for them if they've been vomiting at home, and when it is necessary to take them to the vet. Everything is going to be time-stamped, so if you want to jump around and save yourself some time, absolutely, pop to whichever section you'd like to see. Let's get started. First things first, if your pooch is exhibiting any of the following symptoms, please stop this video and go seek veterinary advice. Symptoms that we need to be worried for are, number one, unproductive vomiting or dry retching, so when they're sort of and really trying to bring something up but aren't quite getting there. The most concerning thing we have for this is something called gastric dilation volvulus, GDV, more colloquially known as bloat, and that is a surgical emergency. Certain breeds are more prone to getting bloat, so your sort of big breed, deep-chested dogs, so your Great Danes, your Weimaraners, your St. Bernards, your Irish Setters, your Basset Hounds, those sort of dogs. The very first bloat I actually ever saw was in a beagle, so any type of dog can get bloat. It's not specific to those breeds, it's just far more common in those breeds. I've definitely seen bloat in Labradors. Dachshunds would be the other one. The other time we can sometimes see unproductive retching, sort of that thing going on, is if they have something caught in their esophagus or in their food pipe, and that too is an emergency and needs to be seen by a vet pretty quickly. Number two is blood in the vomit. So blood in the vomit can sort of present in two ways. One is when you have very obvious, clear, red, stringy blood in the vomit. The other one is not so obvious. When blood gets digested, it sort of becomes a lot darker and has what we call a coffee ground appearance. So if you see something that looks like coffee grounds in your dog's vomit or fresh red blood in your vomit, both of those things need to be assessed. Number three is repeated or ongoing vomiting. So if your dog has been vomiting a couple of times a day for a couple of days, that should be assessed. Normally what I say is if they've been vomiting more than 24 hours or if they're vomiting more than 2, 3, 4 times in a day, depending on their demeanour, it's worthwhile getting checked out. 4 is if they're lethargic or depressed or just, sad. So if you've got a normally super energetic dog that's always running around, always keen to eat, always happy, and they're just lying in bed and they're super miserable, and maybe they have only vomited once, you've got to look at everything as a whole, not just one thing. But if they're very lethargic, very depressed, then that is worthwhile checking out. Number 5 is if they are looking dehydrated. Obviously, if a dog is vomiting, they're losing fluid, and quite often dogs, they're not silly, they will go and drink more water to help replenish them, but sometimes that's not enough, or there's something going on which means their body can't absorb the water as well. Now, one thing that you can do at home to assess hydration in your dog, assuming it's safe and you've got a nice friendly dog and all that, is you can sort of pinch the skin between their shoulder blades. This is something that's a little bit more tricky to appreciate in really hairy dogs, but if you pinch their skin up, it should flatten out pretty immediately. It should go up and then go down pretty fast. If it's sitting up and sort of what we call tenting up for a couple of seconds or a second or two, that indicates dehydration and that they may need some extra help. Number 6 is abdominal pain. So if they've sort of got a hunch posture, if they're crying when you touch their belly and sort of walking around, sort of looking a little bit miserable, that can indicate lots of things, but it can indicate abdominal pain. 7 is if they're not keeping water down. So if every time they drink water they vomit, that is something that is quite concerning. 8 is their age. So if you have a very old dog or a senior dog, which does vary based on the breed that they are, or a very young puppy, they do need to be seen more quickly because they are more fragile. And number 9 is kind of a simple one, but I have to throw it in there. But if you know or are strongly suspicious that your dog has eaten something that's toxic or that could cause a foreign body, so if they have eaten rat bait or snail bait or chocolate, or if you saw them eat a corn cob the night before, if you know something's going on, take them to the vet, get them checked out. Sometimes dogs can pass things, or sometimes they can eat only a small amount of something and it's not a big deal. But if you miss it, it can become a really big deal. So if you know something's going on, please get it checked, because unfortunately I have seen clients who have known exactly what's happened, and for whatever reason they have elected to wait just to see if it gets better on its own. And some of them occasionally do, but a lot of them don't. And the longer you leave it, the more challenging it is to treat. Okay, now that's out of the way, let's spend a little bit of time talking about what vomiting is and why your dog may be vomiting. Now we're going to talk about what is vomiting and how can we distinguish it from something called regurgitation and why should we care. So first let's clarify what we mean by vomiting. Vomiting is active abdominal, that is tummy contractions, bringing food up from the stomach or the gastrointestinal system. And normally when you see a dog vomiting, you will have some warning signs. So dogs can act nauseous, so they can lick their lips, they can have a little bit of hypersalivation or drooling, and when they do vomit, there's usually some active abdominal contraction sort of to bring the food up. In terms of what comes up, you can have partially digested food. Sometimes the food comes up largely as they ate it. You can get a little bit of bile in their food, so that yellow stringy stuff that comes through. And it can sometimes smell a little bit sour, like have that sort of sicky smell to it. Vomiting is different to regurgitation. Regurgitation is a passive process, so a process that doesn't require any effort, where food is brought up from the esophagus or the food pipe. And regurgitation is where food comes up passively, that is without effort, and usually looks very similar to when it went down. So there's been no digestion to take place. Typically there's no warning signs, so the dog isn't nauseous, they're not upset, they're not particularly phased. The easiest way that I have to distinguish vomiting or having episodes of regurgitation is to ask the owner, do you know your dog's about to bring up food? Because most owners with vomiting know that something's about to happen. They see the drooling, they see the sort of the sad sicky face, and they sort of rush them off the carpet and that sort of thing. Whereas with regurgitation, it's kind of like a baby spitting up. You don't know, it just all sort of comes out and you weren't prepared for it. You can't predict that it's about to happen. And the reason that it is actually really important to work out, are we vomiting or do we have regurgitation, is that quite different disease processes cause each of those two signs. So the tests that we want to do or the importance of working out what's going on is a little bit different. Regurgitation usually is quite serious, so we tend to be a bit more aggressive in terms of working out what's going on, whereas vomiting, there's a whole spectrum of it. Can be, pretty much nothing, and we don't need to do very much, to all the way to doing big surgeries and all sorts of things. So that is an important distinguishment. So vomiting, you know what's going to happen. Regurgitation, you generally don't. In summary, vomiting is basically food material coming from the stomach or the small intestine or the upper intestine. It's usually active and forceful. Usually there are warning signs. So they're licking their lips, they've got a sad, sicky expression. They can have some drooling and hypersalivation. It can really be at any time in relation to eating. So they can vomit straight away after eating, or they can vomit an hour or two later, or even longer. There is a variable degree of digestion. So depending how long the food's been in the stomach, there might be a little bit of digestion. It might come up largely as it went down. You can have the bile, the yellow liquid coming through. This is in contrast to regurgitation. Regurgitation is food matter that comes up from the esophagus or the food pipe, and it is passively expelled. So there's no effort involved. The dogs are usually not fazed by this. There are no warning signs. You don't know what's about to happen. It can be very sudden, and it can be in any time in relation to eating, although it's more common to occur more quickly after eating. Sometimes they can just bring up some sort of frothy saliva as well. So regurgitation versus vomiting. Hopefully that is clear. And now let's go on to other things. So now that we know your dog is vomiting, let's talk about why they may be vomiting. There are a lot of reasons why a dog can vomit, similar to humans. How long is a piece of string? I have tried to characterize the more common reasons dogs vomit, and I came up with 13 categories. So that's a lot, but we'll work through them and make it simple. So number one is dietary indiscretion, which is basically just another way of saying that your dog has eaten something that they shouldn't. So whether it's things like household scraps, if they've eaten something when they've rushed off into the bushes on their walk, garbage, table scraps, all that sort of thing. Dogs can eat something that their body just says, nope, don't like it, don't want it, and they vomit it up. End of, and that's it. Number two is eating too fast. Certain breeds are definitely more prone to this than others. Labradors come to mind, but if they eat their food too fast, they can immediately bring it back up. Three is if they've had a rapid dietary change. So if they've been on diet X for however long, and then for whatever reason, and sometimes there's very good reasons to change diets, we move them to diet Y, and we do it sort of too quickly, they can have some tummy upsets. Four is motion sickness, colloquially known as car sickness. Particularly when they're younger, it's definitely not uncommon to have a puppy come in for a vaccination or an early health check, and they've had a little bit of vomiting in the car trip. But that sort of motion sickness can make them a little bit ill. Five is your classic foreign bodies. So your corn cobs, your socks, your children's toys, books, tennis balls, underwear, jewellery, pips from fruit, so peach pips and that sort of thing, rocks. I did once have a Labrador present because he'd eaten an entire chicken. The chicken was alive at the time, unfortunately, but he'd eaten an entire chicken and was not feeling too good. So whatever they can fit into their mouth, they can eat. 6 is psychological stress or excitement. So this is something that's a little bit extrapolated from human medicine, but if you have ever had a big exam or something really important coming up, or if you've heard shocking news that you weren't expecting and you can get that sort of sick to the stomach feeling. Definitely for me before exams and also before exam results came out, I always felt really nauseous, really sick, like my tummy just sort of cramped up. And I did have friends who did actually vomit before exams. They'd get so stressed. And it stands to reason that dogs are the same. And I've definitely had clients come in who have had a big change, so a big environmental change, or somebody's moved in, or out of the house, so people moving in or out, pets moving in or out, renovations, moving house, all that sort of thing. Certain dogs can go off their food a little bit during those sort of big change times, and I have definitely had some very astute owners notice this pattern in their animals and monitor it quite comfortably at home, but it is something to be aware of. So that's why getting a history and giving your vet the full history in terms of what's going on at home is really important, because the dog can't talk. You have to be their voice. 7 is abdominal disease. So that's your gastritis, your pancreatitis, your peritonitis, your intussusceptions, your pyometras, your cancers, your inflammatory bowel diseases, anything that can go wrong in the stomach that can cause vomiting. You do also have metabolic diseases. So that's your kidney disease, your liver disease, if your electrolytes are out of whack for some reason, or if your acids and bases are out of whack for whatever reason, that can cause vomiting. Endocrine disease can cause vomiting as well, so Addison's or hypoadrenocorticism and hyperthyroidism, which is definitely less common in dogs, but both of those things can cause vomiting. Number 10, your drugs and your toxins, and there are a lot of these as well. So your heavy metals, your ethyl glycol, which is antifreeze, raisins, grapes, chocolate, onions, garlic, caffeine or coffee, fertilizer, macadamia nuts, xylitol, which is the artificial sugar that people put in to make food taste nice. Dogs do not tolerate that at all well. It's very, very, very bad for their liver. Infectious causes, so I think we're at number 11, infectious causes. So parvovirus, distemper, salmonella, campylobacteria, E. coli, all that sort of thing can cause vomiting. Your intestinal parasites, so hookworm, whipworm, roundworm, tapeworm, giardia, coccidia, helicobacteria, all those things can cause vomiting as well. And then you have your large intestinal disease, so constipation if it's really severe, cancer in the colon, colitis, so inflammation of the colon can cause vomiting as well. So that's all I've got. I will list them all down so you can have a little peruse, but that is the causes of vomiting. Next up is we're going to talk about home care when your dog is vomiting. So when is home care appropriate? So if your dog has only vomited once or twice, is drinking water and holding it down, and is otherwise their pretty much happy self, maybe they're a little bit sad, but they're generally their same old self, then you can try home management first. So the 12 to 24 hour protocol that I recommend to my clients is to fast the tummy a little bit. We used to recommend fasting them for days. That is something we don't do anymore. Starving the good bacteria in the gut is not good. So usually I tell people skip a meal. So if they eat twice a day, skip the morning meal and then offer them food at night. If they eat 3 times a day, maybe offer them a tiny little bit at lunchtime. But you do want to withhold food for at least 8 hours just to let the tummy have time to settle. Crucially, never ever ever withhold water from dogs, particularly if they are vomiting. You want them to keep their hydration up. You can give them ice cubes or put a few ice cubes in the water. That can encourage dogs to drink, and it can be a little bit easier for them to keep down. Or just make sure you're offering water, and just do keep an eye on their water intake. Make sure they are drinking a little bit if they have been vomiting, otherwise they may get dehydrated. After you've missed a meal or fasted them for sort of 8 to 12 hours, do offer them a very bland, gentle food. So generally what we recommend is cooked chicken, just boiled. You can just poach it. You can bake it if you want as well, but just make sure you don't put any seasonings on it. Make sure there's no bones in it. You want it as bland and boring as possible. And a little bit of rice, usually 1 part chicken to 3 parts of rice. You can add in a little bit of cooked sweet potato or pumpkin to it as well, and feed in small, frequent amounts. So 1/4 to 1/3 of what they normally would eat. And if they hold that down over a couple of hours, so say 3 hours, then you can offer them a little bit more and just keep doing that. So maybe feed them, a small amount 3, 4, 5 times a day. If you are working, like everybody does nowadays, with the cost of living, and you're not at home to monitor them and give them the food all the time, that is okay. As long as they are drinking water and holding it down for the first 24 hours, offer them a little bit of food before you go to work, and then as soon as you get home from work, offer them a little bit, and then give them a little bit more just before you go to bed, or sort of work it out depending on what your schedule is. Once you have been feeding them the bland diet and small amounts often, and they've been fine and not vomiting and happy and all that sort of thing, don't immediately transition back to what they were eating. Do it slowly, because otherwise it can be too much for them. So over 3-4 days, slowly transition from the bland diet back to their normal diet, just to give their tummy time to get back to normal. Other things you can do is you can put in a little bit of bone broth. Check the salt content of that. You don't want that to be too high, and make sure there's no onions or garlic or bad things for dogs in there, but bone broth can be really good to mix in as well. And you can give them probiotics too. Make sure you stick to dog probiotics and not human probiotics, because they are quite different, but a little bit of probiotic can help their tummy as well, restore the normal flora and fauna. Things not to give them is never give them human tummy medications. They can be quite bad for dogs. If you've spoken to your vet and they've said you can use XYZ and you've gone through the dose and that sort of thing, totally fine. But if you haven't, don't guess, because there are some things that are quite bad for dogs and can make things a lot worse. So dogs are not small humans. Don't give them human medication unless it's been discussed previously. Prevention is always better than the cure, and there are a few things you can do to help reduce the risk of vomiting and vomiting episodes. Obviously, things can happen, and they just happen. There's no way you can prevent it, so I'm not saying this is the be-all and end-all, but there are some things you can do to help minimize the risk of vomiting. The first is, number one, feed appropriate portions. So there are some dogs you can put a whole pile of food in front of them, and they will self-regulate, eat what they need, go on their merry way, and everything is fine. A lot of dogs won't do that. They'll just keep eating until they're totally full, their belly is beyond full, and then they'll vomit it all up. So just feed them what they need. If you have a dog that is a fast feeder and eats so fast that they do vomit up, you can get slow feeders, you can get puzzle feeders, and there's lots of different things on the market that can help reduce the speed of them eating. 2 is to make dietary changes gradually and slowly. It's always better to go slower rather than faster, particularly if you've had a dog that's been on diet X for years potentially, and you're switching them for whatever reason onto diet Y. Do it slowly. If you do it too quickly, you can get vomiting. So in terms of how fast, if they've been on a diet for years, I'd say 1 to 2 weeks, just to transition them over and just gradually increase their new diet, decrease their old diet, just to give their tummies time to adjust. 3, the fun one, keep garbage secure. So have your garbage tucked away, have your garbage somewhere where the dog can't get into it. Even if they're an animal that's never gotten into garbage before, it only takes once, famous lines, it only takes once for something bad to happen. Just keep it tucked away. If you're going on walks with them, keep an eye on where they are and where they're going. And even if you see them eat something and you can't stop them, at least you've got an inkling that, hey, maybe that's the cause of why a dog is vomiting, because that is important information. 4, particularly for anxious and stressful dogs, try and maintain a stable routine with them. Obviously life happens and you can't always do the same thing every single day. I get that, that is fine. But as much as you can, try and keep their routine the same, try and keep their interactions with people the same. And if you do have to change the routine, just be mindful that things have changed, and particularly in your more stressy, anxious dogs, that can affect them and make them feel a little bit nauseous at times. 5 is regular vet checkups. So just like us, going and getting checked, keeping an eye on your weight, checking blood values for older dogs to see if anything is changing or creeping up, even if it's in the normal range. If it's creeping up, we might want to keep an eye on that, because it's always better to catch something early than later. We can implement things to slow things down or even cure it, depending on what's going on. So just regular checkups are a good idea. And finally, number 6 is just, you know your dog best. You know your dog's normal behavior, and you are the expert on your pet. So if you are worried, and my famous thing is, or maybe not famous, one of the things I always say to people is that if you're concerned, I'm concerned. You know your pet best, and if you're worried, let's check them out. Early detection can make a huge difference. Not to be dramatic, but sometimes it can be the difference between life and death for some pets. So always good to check. They're like little kids, they can't talk, and it can be quite tricky. So if you're looking at them thinking, oh, I'm not feeling so good about this, get them checked. Okay, that brings us to a close. I guess the final thought that I would have is that just remember, you are the pet parent and you know your dog best. And if you are worried, we are worried. So if in doubt, it's always worthwhile making that call to your vet, at the very least have a chat about what's going on. We'd always much rather see your pet when either everything is chill and everything is fine, or we have something very minor going on that we can fix relatively easily, or if we do have something more serious going on, at least we've caught it early and we haven't left it to potentially get worse. If you found this helpful, please give it a like and subscribe. If you've got any questions or comments or anything you want me to cover in the future, please pop it down below. I do try to respond to as many as I can. That was a tongue twister. Thank you so much for watching. I really do appreciate it. You guys have a good day.